Here's what we're watching today. Cannabis stocks have exploded after President Donald Trump released a video endorsing Cannabidiol, or CBD, as a major part of senior healthcare. In the video, he called CBD the most important senior health initiative of the century and urged that Medicare cover it. That's not just a casual remark. It's the President of the United States pointing to cannabis, and specifically CBD, as a potential solution to one of the nation's biggest challenges: caring for an aging population while controlling healthcare costs. The markets reacted instantly. Cannabis stocks across the board jumped, with Tilray, Canopy Growth, Aurora, and Cronos leading the charge. The U.S. Cannabis ETF, known as MSOS, surged more than 20% in a single day, putting it on pace for its best quarter ever. Trading volume spiked, and suddenly, investors were treating cannabis companies like they were back in the boom years. But here's the key question. Is this just a flash in the pan? Or are we actually looking at the beginning of a serious policy shift in Washington? The video itself, produced by a group called the Commonwealth Project, makes the case that CBD isn't just a wellness product you see at the local pharmacy. It explains how CBD interacts with the body's endocannabinoid system, a network of receptors that helps regulate stress, sleep, pain, and mood. The president framed CBD as a way to ease pain, improve mental health, slow disease progression, and maybe, most importantly, cut down on the number of costly prescription drugs seniors rely on. The idea is that by using CBD, Medicare could save billions, seniors could feel better, and healthcare outcomes might actually improve. That's why the markets jumped. Not because of what's happening today, but because of what might happen tomorrow. If Medicare coverage for CBD ever became reality, it would open the floodgates. Doctors would feel more comfortable recommending it. Pharmacies would stock it. Seniors who are hesitant today might try it, knowing insurance would help cover the cost. And for cannabis companies, it would mean legitimacy, stability, and profits. But let's slow down for a moment, because as of right now, nothing has changed legally. Cannabis in most forms is still classified as a Schedule I drug under federal law, which puts it in the same category as heroin. That classification creates enormous obstacles for research and blocks most cannabis businesses from traditional banking. On top of that, there's Section 280E of the U.S. tax code, which prevents cannabis companies from deducting most normal business expenses. It's one of the biggest reasons so many cannabis firms struggle to turn a profit, even when they're selling hundreds of millions of dollars worth of products. If cannabis were rescheduled, or if 280E were reformed, the entire financial picture of the industry would shift overnight. This moment also connects back to the 2018 Farm Bill, which federally legalized hemp. Hemp and marijuana are both cannabis. But hemp is legally defined as cannabis with less than 0.3% THC. That distinction opened the door for a flood of hemp-derived products, from CBD oils to gummies and creams. The Farm Bill was the first real federal opening for cannabis in decades, but it also created confusion. Suddenly, you had legal CBD alongside illegal THC, and state regulators trying to make sense of it all. That patchwork is what we've been living with ever since. There have been attempts in Congress to move beyond that patchwork. The SAFE Banking Act, for example, has been floating around Capitol Hill for years. It would allow cannabis companies to use traditional banks instead of being forced into cash-only operations. Versions of legalization bills have also been introduced. The MORE Act, the STATES Act, the CAOA. They've passed the House a couple of times, but never made it through the Senate. Every time momentum builds, politics gets in the way. Republicans worry about legalization going too far. Democrats push for broad reforms that stall out when votes get tight. And the result is deadlock. So when President Trump posts a video saying CBD should be covered by Medicare, investors see it as a potential breakthrough. They see it as a signal that maybe, just maybe, the logjam in Washington could start to move. But it's worth remembering. This wouldn't be the first time hype has outpaced reality. Back in 2018, After Canada legalized recreational marijuana, U.S. cannabis stocks soared. People thought America would follow quickly. Instead, reform stalled, stocks collapsed, and investors got burned. That history is still fresh in a lot of minds. Now, to be fair, the case for CBD is stronger today than it was back then. Millions of Americans use it already, and surveys suggest nearly 1 in 5 seniors have tried it. Advocates argue it can reduce opioid use, improve quality of life, and save Medicare tens of billions. Critics, though, warn that the science isn't settled. CBD can interact with other drugs, and its long-term effects still need more study. Doctors want more clinical trials before prescribing it broadly, and some lawmakers are actually pushing in the other direction, proposing tighter restrictions on hemp-derived products like Delta-8 and Delta-9 THC, saying the market has gotten out of control. So the debate is far from simple. What's clear is that Trump's video has reignited interest. The question now is whether it leads to actual change. Will the DEA move forward with rescheduling cannabis, lowering it from Schedule 1 to Schedule 3? That alone would lift massive tax burdens and make research easier. Will Congress introduce bills to add CBD to Medicare coverage? Will regulators step in to create a clearer national framework for hemp and CBD products? These are the kinds of steps that would turn today's market rally into a lasting shift. Until then, it's speculation. Markets are betting that words will turn into action. And that's always a risky bet. But politically, the timing makes sense. Prescription drug prices are one of the hottest issues in the country. Seniors are a crucial voting bloc. And cannabis reform in some form polls well across party lines. Framing CBD as both a healthcare solution and a cost saver for Medicare could be a powerful message in the upcoming election season. So here's where things stand. Today's rally is real. Stocks are up, investors are excited, and momentum is back in the cannabis space. But the fundamentals haven't changed yet. The industry still faces huge barriers. Whether this is the start of real reform or just another short-lived spike will depend on what happens next in Washington. For now, all we can do is watch. That's what we're watching today. If you found this update helpful, don't forget to like, subscribe, and hit the notification bell so you don't miss the next one. Thanks for watching.